And I'm Charlie Toledo. I'm reporting on Napa County, which is just north of here. And our accomplishments have been great. We have many agencies who work collaboratively and very cooperatively to provide services to people who have been victimized or low income or at risk. We also have very generous individuals, foundations, and funders who provide financial support to all of these organizations. We are doing prevention work in the schools, in the community, upstream approach to safety, starting at the younger groups. There are 2 hospitals that provide health care and 1 overwhelmed low-income clinic. There's many women-owned businesses, and in leadership we have 2 mayors that are women and 1 supervisor. Unfortunately, when they first went into leadership, they decommissioned the Commission on Status of Women in Napa County. I guess they figured they had arrived, so everything was fine. Some of the good things that have occurred in the county, because we're talking about progress and accomplishments, is an upgraded mass transit plan with very east-west corridors, which never existed before. There was a north-south corridor, but now there's east-west, north-south. Men are more involved in child care and transportation of children than ever before. We have a school district that has open school enrollment, so parents can choose any school district that they want to put their children in. And we have a community college and a 4-year private college. There's many alternative opportunities for extended education and workforce retraining. Native Americans have finally been included in mental health funds. That was after 15 years of lobbying on behalf of my organization. Native Americans have the highest suicide rate of any ethnic group in the world, plus the lowest life expectancy of any group in the United States. The life expectancy right now of a Native American is 48 years of age. So with these current contracts that our organization has gotten, we have the capacity now to collaborate and network with regional agencies for community-based wellness and to be lobbying and attacking and addressing some of those core issues that are very broad. The barriers and setbacks is that even though Napa County is a wealthy and safe community to live in, the domestic violence, sexual assault, and child abuse is still very high. At 96 victims of domestic violence and sexual assault in this last year. The majority of those were children under 18 years, and the perpetrator was someone known to the victim. We had 1 child homicide and 2 unfortunate domestic violence issues that ended up in the death of the mothers, the women. We face issues with immigration, lack of affordable housing, lack of legal services, lack of cultural competency, and many other obstacles that prevent women and children from seeking safety or feeling safe in their homes. The remote rural areas of Napa County do not have mass transit, nor do they have broadband services. The main hospital that serves us and has been very good about serving low income. They've been on strike for the last 3 weeks because of the low pay and the understaffed, they're just understaffing all the nurses. So our priority recommendations to the state, the California State Action Plan, to create a functional immigration policy that creates safe corridors and processing for immigrants as integral component of the hospitality and agricultural industries. This is the core of the economic base, so to create a functional immigration policy. And the second, really, and this might be the first, because nothing else matters if we don't establish clean water for our population. All the headwaters in California are gone dry. I addressed this issue last year. It's only gotten worse. We have to focus on restructuring our water systems. What is set up in place was created 100 years ago, and it has reached the end of its sustainability. So we have to recreate how we think about water, how we use water. Conservation, recycling, and reuse has to be the base for that. We have to start saving and very, very stringently using. I'm recommending to the state, fortunately I sit on a low-income oversight board that makes recommendations directly to the CPUC, and I'm recommending that water be rationed now while we still have water to ration. This is critical and it's not hypothetical. To maintain environmental protections, especially around the creeks, rivers, and oceans, to see them as living beings. If you cut blood off to the foot, the body dies. The main water sources are no longer reaching the ocean in California. The Colorado River, which is the main water supply to Los Angeles, is 19 miles from the ocean. The headwaters, the Klamath, the Trinity that Jeannie was referring to earlier, those waters are going dry. That's like cutting blood from the head to the rest of the body. And people don't seem to understand. It seems really simple to me, and I've been pleading with whatever agencies I could have access to for the last 10 years that the headwaters are going dry. Well, now that is a moot point. They are dry. So we need to really start using the sacred water, realizing it is a precious resource. At the state level, to create mass transit for all regions of the state while requiring the counties to follow the CEQA guidelines. Those are federal guidelines for clean air and water. The housing employment ratio is supposed to be 60% of the population that works in the area is supposed to live in the area. So when jobs are being created, there has to be that housing component that is creating housing right alongside of those low-cost jobs. We have to match the wage scales to jobs and housing costs, and allow the Native American tribes to have access to and protect their sacred sites and burial grounds. Oh.